Well, good morning, everyone. I think Katie did a great job of kind of setting up the aspects and the application of the CD+SI, so I'm going to spend a little bit more time talking about the overall design of it, the purpose, and how we've been able to kind of synthesize it together for the purposes of looking at effective engagement and outreach within our communities and through our programs. I'm Abigail Borron, and I'm an associate professor at UGA, and a few of my colleagues and I have worked on this for the last few years, just trying to really establish kind of what we're referencing as a toolkit, although that is a very variable term, as you'll come to see. One of the reasons why I have really honed in on this particular aspect of engagement around extension is because I think back on, wow, I've worked in extension for 20 years now and in varying capacities, and I have noticed that there are just, even within the context of the United States, we have a lot of opportunity, but we also have a lot of challenges as it relates to the unique needs at the local level. And when you place that into the context of even developing nations, we realize that there is a lack of a uniform structure, or historically we have seen that lack of a uniform structure, especially when it comes to implementation and evaluation of programs. And so if you look through the literature, there's, over time, especially when it comes to the late 20th century, there is this call from development scholars to move toward pluralism, specifically as it relates to decentralization, privatization of extension service, and then, of course, cooperation with beneficiaries, which I think we're all familiar with in that respect. But even with these particular movements and these call for reforms, there are shortcomings, specifically as it relates to the exclusion of poor producers from the decision-making process. And again, even Katie referenced that as it related to who are the voices at the table when it comes to some of the different efforts, the localized efforts, and even from a coalition standpoint, who is included and who perhaps is missing. And then obviously having diverging approaches, which compromises evaluation. And as we know, within the context of extension, evaluation is probably one of our largest challenges that we face, just trying to come up with particular approaches to evaluation that allow us to look at things holistically, but also meaningfully at that very specific local level of a given program. And so alternative approaches have continued to emerge through that time, recognizing those particular shortcomings. One of them is the democratization process of development, and then working alongside entrepreneurs and community members, understanding institutional limitations, and then focus on situation-specific needs in even the culture of target communities. And all of this in many ways have pointed to the aspects of community development, specifically emphasizing these intangible elements of areas of decision making and then human capital and society. And so, of course, we have the formalized program area of community development, but we see a lot of that aspect in all of our program areas for extension. So, when you look at those particular alternative approaches, while these scholarly approaches to push community development forward over this period vary greatly, of course I think that we can recognize the variation in these approaches and methodology. It has given us the opportunity to gain significant attention on particular themes of personal agency and solidarity among community members. I feel like I always see that every single time somebody gives a presentation on research that was done in local communities or even across the scope of a small developing country, that you see these aspects and themes of agency and solidarity among those particular groups or the given project in particular. So that results in identifying and thinking about who specifically is at the table and how are they engaged in identifying very particular needs that are unique to that given community or within that targeted group. And then what role do they play in development of community-based programming? And these are all of the different aspects that I think over the years I've heard continually brought up in conversation, but it's oftentimes always the challenges that we face as it relates to identifying each of these meaningfully and systematically. So when we think about the resulting opportunity is we have this aspect of the evaluation process. We have to be able to reconsider it. And again, I know that I'm not necessarily bringing new information to the table. I'm just trying to set up the purpose of why we are even looking at this. So if we have this need to look at the, reconsider the evaluation process, that also incorporates that development piece of the program itself, and then the delivery and implementation of that program, and how those all can continually function and work in a cyclical fashion, or at least they should be. And I think a lot of times it's always hard because we're like, okay, we have the program area or the program specific that we need, and then of course we need an evaluation piece to it, so what does that need to look like? And so in my mind, thinking, how do we continually ensure that those are always constantly working in tandem? And so therefore, one of the aspects that I had, an opportunity I had several years ago was to work in this fellowship program with a sector of our university that was focused specifically on public service and outreach. And one of the things that I kept asking the question of is, can we even look at specifically identifying how do we evaluate and measure social impact? It's very easy when it comes to the economic side and even the numbers side, when we, how many people participated, what are the reported behavior changes and so forth. But meaningfully looking at, can we evaluate the social impact of a program at that local level? And so that's what I began to really endeavor in looking at, how do we go about doing this? And so this is kind of the development of the Community Diagnostics and Social Impact Toolkit. It implies this inside-out perspective, which, it's always easy for us to kind of have that top-down model. And I know, again, I'm not necessarily bringing anything new to the table when it comes to saying, let's consider the inside-out perspective, starting at that local level. What's going on before we even start asking very particular questions? And so by taking this inside-out perspective, I'm also applying this two-part assumption. One is that regardless of the presence or absence of university programming, the community profile or the diagnostic side of the community needs to first be taken into consideration. And then secondly, what are the local identifying and assuming that local perceptions are critical to shifts. So whether they're positive or negative, related to community development and vitality. So if individuals have perceptions around opportunities or roadblocks and so forth, that's going to affect the progress or success of given programs. So as Katie already mentioned, the conceptual framework of the CD+SI is built off of the Community Capitals framework, which Katie did a very nice job of describing each of those specifically and how they work in tandem and they function as that kind of holistic set of assets within a given community. But then also bringing into consideration the culture-centered approach. The purpose of bringing in the culture-centered approach, which I believe is absolutely essential, is being able to take into consideration the fact that when we look at a given community, you're going to have other things at play, right? It's very easy to just look at the community capitals, but there's something else also going on, and the culture-centered approach considers the contested intersections of three key constructs: culture, structure, and agency. So culture is the traditions, the practices, the local or localized beliefs that are taking place at that local level. But then you also have structure. Structure is historical knowledge, produced knowledge, policy, varying degrees of power structure, and how information is disseminated and how resources are disseminated, which then affects agency in terms of from an individual standpoint. Do individuals believe that they have access to key and needed resources? If they do they believe that they can utilize it to the extent that they need to for the purposes of their given culture and sets of beliefs? Right, so again, there's these contested intersections that exist between and among all of those. So when we look at those two brought together, there are two scales we developed. One specifically looks at how individuals perceive their community across all of the given capitals. And we have a set of statements for each of the capitals as it relates to how individuals perceive their outward community. And then we also have sets of statements that represent each capital in terms of how individuals perceive their own personal internal agency, or how they believe they can actually access and live out their needs in their community. So what we wanted to do was, can we take both of those scales and those two dimensions represented in the CD+SI can we categorize communities based on individuals' perceptions of their community and personal agency within their community? Can both of those scales work in tandem to help us and guide us to where we need to go for the purposes of program development, implementation, and ultimately evaluation, which can include social impact assessment? So what we did is we took the CD+SI instrument with both the community perceptions and perceived personal ability or perceived agency, and administered that across the state of Georgia using a non-probability opt-in sampling. We had 3,400 completed surveys, which represented 152 out of our 159 counties for the state of Georgia. Of course, the remaining 7 are just incredibly hard to reach, very rural communities. And then the data were grouped and analyzed with county of residence as the proxy for community. So again, we did that specifically because of how extension functions within the state of Georgia from community or from county to county. The resulting scores were analyzed to ascertain if communities exhibited either high or low levels of overall capital based on kind of community perceptions and then their perceived ability within their community. We established an overall capital rating, which is based on establishing an index score comprising the mean value of the community perceptions and perceived agency scales for each survey participant. And then the community index score was calculated from the average of individual index scores within the community. And then lastly, we took both scales, the z-scores for both scales for each community calculated and plotted in a two-way scatter plot resulting in a single community data point for each county located within a matrix quadrant. So here's the resulting plot, or the points that we plotted in the scatter plot. Of course, I don't think that we're necessarily looking at something that overly shocked us. We anticipated that there should be at least a fairly positive correlation from perception of community and then personal agency. And like I said, each point is a county in the state of Georgia moving forward. So while the scatter plot demonstrates a moderately strong and positive linear association, there is an opportunity in what we see through this analysis to further analyze the 6 capitals represented in each scale and examine the unique assets and deficits that exist within that county, especially when you look at high-low or low-high categories. And one of the reasons why I was really intent of wanting to look to see, can we even visually see where counties fall across the state of Georgia, is because even when you move into, you go to the next slide, when you look at some of these, we may have that relatively strong positive correlation, but there are some unique outliers. And we haven't delved into exactly what makes these particularly unique. But one of the things that we can see is that most of the counties fall right here, but we have some that are uniquely outside of that. And even still, there are 4 quadrants represented. So does that mean, or should we be looking at program development uniquely from each quadrant perspective? High-low, high-high, low-high, and so forth. And does that create new questions that we're asking for entry points into conversation to identify what are the key issues we should be focusing on, and how do we start focusing on those key issues? So the CDSI data combined with the metrics, we really think that we can take the CDSI data and run that alongside, do a comparative analysis with economic data or health indices to figure out, again, where do these uniquely situate counties within the state, a given state or area, to be able to identify creating a more robust lens for program design, delivery, and evaluation. And longitudinally, these may reflect other nascent trends based on community-driven efforts. So we should be able to look at this data over time to see social impact assessment-wise, what's changing in terms of personal agency and the perception around personal agency. And then again, we are the external stakeholder oftentimes as far as interventions are concerned. What does that mean in terms of our involvement and our role in that? And then what do the internal and external collaborative efforts, how can they be shifted and changed based off of this data that we are monitoring over time? So we have, the way we look at it is front-end diagnostics, informing program curriculum and development, allowing us to move into a back-end evaluation. And thank you for your time. And I'm just going to re-emphasize, we've done a lot of work around validating these scales. We've published that work, and now we're moving into specifically designing localized research projects to be able to delve deeper into this collected overall data, but then also building more collaborative relationships across other program areas and disciplines. And we have a postdoc specifically to help move us in that direction. So if you're interested or you know somebody who is interested, please be sure to let me know. Thank you.
Thank you. Dr. Borron, thank you for this excellent presentation. It gives us a lot to think about. Do we have questions from the group?
Yes. So I might have missed this, but I just wanted to clarify. Could you use this on like a specific program, or is it in general first, and then once it's like firmly validated, moving it into looking at developing specific programs?
Yeah, so that's a good question, and I think it can move in either direction. So ideally, you know, of course, I have like this very structured type A personality that wants it to go from beginning to end very neatly with the set of, you know, large scale set of data that then drives us to move in the directions. But what we saw with Katie's presentation that showed, here we're going to utilize this framework to just figure out how individuals are perceiving different aspects of a given project. And how can we start just reframing the conversation to identify particular issues, even placing them into the context of the community capitals framework, and then reconsider the key entry points of conversation for next steps of particular project design and potential evaluation. So I think we utilize the word toolkit. I think that could be variable in terms of how we approach the use of the CDSI. But again, this can be easily focused on a lot of different disciplines: communication, leadership, education, but even into other aspects of community development itself.
Yeah, I was just wanted to add on to what Dr. Drake. No, I've discussed that farm to school study with you, and I showed you my whole big diagram, but I was just thinking about it within the context of that, because they utilized appreciative inquiry on the front end, and just like thinking about what it would look like to go back and almost redo the study, but placing that study within the CBSI. Mm-hmm. So that was kind of wondering if that could be an implication.
Absolutely, yeah.
Thank you for your presentation. It was really interesting to see a whole different point of view of measuring these different characteristics at the same time. And I was wondering what kind of criteria did you measure for, or did we use in the toolkit for the cultural aspect? Because culture has been a little bit difficult to measure over time in a quantitative kind of tool. So can you tell us a little bit about that?
Yeah, so I'm assuming that you're talking about from the scale standpoint,
yeah,
and the survey instrument. So if you're looking at it from how individuals perceive their community, example statements that represent that could be individuals in my community can live out their respective beliefs and traditions. There are access to different cultural or traditions within the community. We have access to different either programs or centers or something to that effect, and I can show you the specific statements. But then the personal agency turns it around and says, I believe that I can live out my beliefs and practices within my community. Now again, and these are the different things, we've been able to validate these scales, but again, when I look at the fact that the validation doesn't necessarily mean that we have created this perfect set of statements that are applicable across, even if we take this into an international perspective, which I think is really essential to consider. What would that look like if we were going to take that into another country altogether?
Dr. Borron, that was actually my question, is have you guys thought about how this might be applied, maybe with new American populations, migrant Latino populations, just different groups even here, well, not here, but US-based?
Yeah, we've thought about it, and that is an area of interest that we would like to move into, but I think that that also takes into consideration ways that the scales need to be reformatted to reflect a given group appropriately. And what I mean by that is sometimes even, you know, is it young youth groups that we could look at? Are they the statements? Should we incorporate pictures? Is it other forms of being able to assess their perceptions of community around these given capitals based on what's most applicable to that particular group? So I think, those are areas that we really want to delve into, but
No, this is a great start.
yeah.
Well, thank you very much for your
Thank you.
presentation.